Alright guys, what is going on? Hopefully you guys are having a great day. Just checking to make sure everything is kind of set up. A lot of technology goes back into having these live sessions, but hopefully you guys can see me. If you can, go ahead and give me a thumbs up in the chat box. But we are going to get started today. I'm not going to wait too long because I want you guys to just get on your day, get the tips, and then move on from there. So today's video is going to be all about 9 steps that I took every single day to crush your clinical rotations. Again, this is going to be in the format of a presentation because the last time I did it, you guys enjoyed it. Hopefully you guys are also noticing that the video quality is better. I have a new camera, so I'm really excited to give that a shot. But this is 9 steps that you take from the very start of your day to the end of your rotation. This really works really well for like your clinical rotations. So if you have any questions while I am recording this, just let me know. Give me a holler. If you're watching this replay, thanks for making it out. But I think you'll really enjoy these 9 steps, and we're going to get to it. But first of all, obviously you guys are here, so thank you for joining the clinical guide, which is how you're getting this training. Or maybe you're watching this replay much later. But this is a presumptive kind of look at what the book is going to look like. It's going to probably be much different once I get my designer to create it. But that's basically what I came up with in 5 minutes, so it looks decent. But a lot more to come regarding the book, so hopefully you guys are excited to kind of see what's going to go into it. Thank you for all of you that have sent out some type of feedback on what you want to see in the book, what questions you have, and I'm really looking forward to having those answers in the final product. So, and then really quickly, I always mention my impossible goal. It's my goal to actually mention it at the end of all my videos. And this is the goal of trying to get to 25,000 subscribers by 2020. I'm going to try to have some type of progress bar. I'm really far away. 1,200 currently, but I think, with a little bit of work, we can get at least close to it, if not to that goal. So I'm going to need your help, like always. So subscribe if you're not. Most likely you are. But share this video or any of my videos that you probably like the best, and just go ahead and share it with a friend. It's going to help me. It's going to help the channel. It's going to help whoever's watching on the other end. But let's get into our 9 steps. And if you are ready, then just give a thumbs up in the comments section, and I'll go ahead and proceed. But I'm just looking to see if you're excited. If you are in this live chat, then just go ahead and give me a thumbs up. But let's get started. 9 steps to just crushing your clinical rotations. So we're going to break this down. This should actually, I didn't change my last one, but this was also Get You Honor. Sorry, I didn't change the title. But this is 9 steps to just basically know what to do day in and day out, have a repeatable system. Quickly back up. You may be struggling with writing your notes. You may be struggling with presenting your patients, understanding what questions to have, also like looking up all the data. There's a lot that goes into like the morning of a rotation, especially if you're on the wards, and there's not enough time. So you need to have like a repeatable system that you can do to where your notes get written, your presentations are on point, and you just don't feel pressured for time. You want to get to that point. So I'm going to teach you kind of the steps that I created to be able to get to that point and just crush my rotations once I had the system kind of nailed down. So step 1 and 2 are really how to effectively pre-round on a patient. One of you guys asked me in the email to include something about pre-rounding in the book and the final product, and I definitely will, but I'm going to actually show you in this video how I use pre-rounding in a very specific way, in a very like step-by-step manner. So there's going to be a 1 to 2. 3 and 4 are really going to get a head start on starting your note before you even see your patient. I'm going to tell you exactly what you need to start writing down, so that way by the time you get back to your note, all you really have to write are the information that you couldn't have gotten without seeing your patient. 5 and 6 are actually seeing your patient, but doing it efficiently. If you are a clinical student, sometimes a patient is going to take a lot more time than you're probably expecting them to, and it's going to kind of put you behind schedule. So you want to kind of have an efficient way of directing your patient and getting the questions and then getting out of there so you can go back to doing your work. 6 and 7 are really how to confirm and adjust. You have a plan every single day. You need to make sure it's nailed down because you don't want to end up presenting and realize you don't have a plan or it's not the right one. So I'm going to teach you how to do that. And then 8 to 9 is just creating a master plan of attack so the rest of your day goes smoothly and quickly. You don't want your rotations to kind of labor on all day. That's what makes it boring, that's what makes it tiring. So you want it to get into a position where you can just enjoy yourself and get through the process as quickly as possible. So 8 to 9 is the master plan of attack. Now I'm going to get right into the tips, no more messing around. So tip number 1 is you got to read about your patients before you go in. And most of people will have some type of electronic medical record. Epic is a big one, so I'm going to go ahead and use that example. But if you don't, then you can skip this step and you just have to kind of apply it as soon as you get to the hospital. But let's say you have Epic. If you have Epic, then you can also access Epic on your phone. Ask your your school how you can do that, what permissions you need. But you can access basic informations about your patients, like what happened overnight, what their labs are looking like, and I'll tell you exactly what you need to know. But really, you just want to make sure, is your patient okay? Did anything crazy happen? Are their labs looking really like crappy? Those are the things you really want to know. And so the great times you can do this is, load up your EMR on your computer when you're at home. Go ahead and shower, eat breakfast, and while you're eating breakfast, just quickly scan through. You're not trying to look at everything. You're not trying to write down anything. This is really an assessment of, is my patient stable? Do they look worse or do they look better? And then so that way you have a direction in mind when you go into the hospital. You know who to see first. You know who's stable. You know what pressing questions to ask them. The rest of your patients may not be as big a priority, at least on the first time notice. So I think you guys will enjoy this. I'm going to actually kind of be creating like a sample note. So as we go through the steps, I'm going to tell you exactly what you should have done by this point. So that way the next step you can have another portion done. And then once it's all done, you'll be able to see how your presentation and your note writing becomes so effortless because you're doing the work in a very systematic approach versus most students will look up their info, interview the patient, try to take the note, and then try to create a presentation out of it. That's a lot of effort for doing repeated tasks, and usually the final product isn't that great. Using this, you have a very focused mindset, and you're going to do much better for yourself. So your daily note, like we've only gone through step 1, so it's really your patient on a piece of paper, whatever you use to track it, and say status good or no. Basically, you want to be able to say, okay, who do I need to see first? You don't even have to write status, but basically anything kind of pertinent that you want to put at the top so that way you know to mention it. Step number 2 is a surefire evaluation system. You need to have a step-by-step way of quickly going through the EMR when you get to the hospital, or maybe when you're at home if you can access it, and just know pertinent information before you see the patient. So this includes vitals. You want to see, do they ever have a fever? Is their heart rate kind of abnormal for whatever reason? Is their blood pressure doing okay? Are they breathing fine? Vitals are huge. Your attending is going to ask about it. If they're normal, it's not that big of a deal, but you want to make sure that there's nothing kind of off the books. You also want to see, did the nurses or one of the residents put a note in for anything that happened overnight where they called in for something? That's because that's likely going to be something the patient's going to bring up, maybe something you want to treat or manage. So just have a list of anything that happened overnight. Sometimes there may be, sometimes there may not be. Labs. If you showed up at the right time and the labs got done at the right time, you probably have access to be able to compare the labs from the day before, the morning of, or maybe the evening if your patients get labs checked several times a day. Just look at them, and this isn't a way to evaluate labs, and this is not a lecture to teach you that. I can do that in a future video, but basically be able to assess, are they looking okay, and if there's something kind of off the books, go ahead and circle it so that way you know to bring it up on your rounds. This is important. You don't want to present every normal finding, but anything vitals wise that's weird, anything overnight that's weird, anything that's a lab that's weird, you want to mention it. So I always like to circle them because when I'm going through my notes system, those are the things I talk about. Consults are also a big one. A big thing about our patients obviously is the plan. And if the plan changes, for example, if you're expecting the cardiologist to take your patient down for cath today, and they said, the patient's actually not stable, we're going to see them in a few days, that's important to know because that changes the whole direction of their care for the next couple of days. So you want to be able to do that. If you don't catch that note, you're going to be assuming your patient's going for cath. You'll probably tell your patient they're going for cath, and then during rounds, that news is going to come out on the opposite end that they're not. So you want to be able to kind of just catch those notes. Make sure if you're expecting infectious disease, a surgeon, or somebody to leave a note, see if they did, and that way you know what direction to go into. And then also, this is small, but make sure, are they in the same room? You don't want to waste time, especially if you're in a big hospital system, of walking to a different floor and realizing your patient is actually not there. So write what room they're in, just make sure that they're in the same room that they were the day before, and just write all these things down. So let's go back to our notes, right? We know if their status is good or not. So you quickly just want to write overnight events. So notable events, anything the consult said is going to change, and then labs and vitals. Just add those in. And again, we're going to come back to this and tell you how to present it. Step number 3. So you got to create a strategic interview plan. You haven't seen your patient yet, but you kind of have an idea of what went on, what questions you want to ask them, and you need to come up with a plan of what kind of direction to take that interview in. So you want to know, what are you going to ask your patient? Obviously, you may know, like for example, I had a patient that overnight fainted, and the nurse caught him fainting when he was going to the restroom. So that obviously something that I had to bring up. But usually we say something along the lines of when you interview your patients. I'll talk about this more later. But you want to say, okay, I heard you fainted last night. What happened? You're directing that conversation to the specific question versus just asking, how was your evening yesterday? The patient may not even mention that they fainted. So be very specific. So once you know something happened, have a strategic way of asking, what happened there. Then after you kind of see the labs, after you see their vitals, or maybe you heard about an overnight event, for example, my patient fainted, there's probably going to be some specific physical findings or exams you want to test for. Your attending is going to ask, okay, the patient fainted. Did you check their blood pressure? Did you have them stand up and check their blood pressure? Different things of that sort. So you want to make a list of all the things that you're going to ask as well as the things you're going to do. Write these down again. Again, we're back at our daily notes. So now you're going to ask, these are going to just be a list of questions you want to ask and physical exam findings that you expect or physical exams that you want to do. So again, you have a list. You haven't seen your patient yet. Now, step number 4 is a little bit weird because it's something that people don't do, but you want to begin your actual note. Sometimes people wait to do their notes after rounds or to do it after lunch. And those are the same classmates that I would find would be spending the very latter halves of the day writing their notes, where I had some time to instead spend time with my patients. And that definitely made me a better clinician. The note writing, not so much. So you want to pre-write your notes. So go ahead and begin with what you know. You know what the prior evening events were. You can at least overview it based off of any notes you've had. If there are no overnight events, just write down no acute overnight events. If the patient does tell you later in their interview that something did happen, obviously scratch that and update it. But at least start presumptively writing based off of what you know. It may be incorrect, but you can make those adjustments once you ask your questions. Update the labs and vitals section. You should probably have this by now. The vitals you should. The labs may be already in by the time you're about to pre-write your notes. So just add those in. And then finally, pre-fill the physical exams you want to do. This is another great way to remind yourself, okay, I need to do these steps, these exams. And so, just to make sure I remember, I'm going to actually just type it in. I need to check for orthostatic. So in my note, I'm going to write orthostatic findings. And so that way I know it's another reminder, go to the patient, check for orthostatics, because my attending is probably definitely going to ask. So ask or put in the physical exams you want to do. And then start writing out a guessed and updated plan. So we're going to keep going with this patient that fainted of mine. Before I even saw him, there's plenty of reasons a patient can faint. They can have poor blood pressure. They can have some weird electrolyte abnormalities. They could have something in their head that caused them to faint, some type of trauma, something with their heart. So there's a lot of things you may want to do. So your problem, obviously, is patient fainted. All right. So fainting is obviously a problem. And so you want to say, okay, to test fainting, going to reassess patient's blood pressure, going to check an EKG, consider maybe a CT or an MRI. Not all of those are right, and you probably won't even do most of them, but these are basically things that you're putting in kind of motion in your head, so knowing, okay, these are the options I have in case my attending asks me. So start writing this down. So let's go back to our notes. Expected plan. So you have different problem lists. You also know what problems your patient had from the day before. What are you going to do to update them? Maybe you're for sure your patient's going to stop taking an antibiotic because they finished the time they should be taking it. Or maybe you know that the patient is going to need some imaging studies for whatever reason. So write the guest plan out in your note via problem list or via systems, however your attending told you that they wanted you to do it. And it's unconfirmed now, so obviously you're not going to hit submit. You're just going to save the draft and you're going to move on. But look at how much your note is already written. And if you more and more you do the system, you'll realize it's going to be quicker. It's going to be faster. So just understand that part is that you have a good portion of your note already done. You haven't even seen your patient, so that's pretty wild. Most people don't do it this way, but I think you'll love it if you do. So let's get into the next one. So step number 5, you got to get to the doctoring, so you got to see your patient. But we want to do this in a very efficient manner. Kind of already started this conversation, but instead of going, hey, Mrs. Johnson, how are you doing today? Did you have an okay night? That's a great way to start a conversation, but your patient's likely waking up from sleeping, from you bothering them. They don't really want to tell you about their night. So instead say, hey, Miss Johnson, hopefully you're doing okay. I saw that, you fainted last night. What happened there? And then they'll tell you some details, and take those notes, ask those questions that you wrote down, and then obviously ask anything else. Was there, anything else that I should know about last night? Did you sleep okay? Are you having any issues with A, B, and C? And then if they say, anything additional, then keep that noted or jotted down. They may not. They may add something. Who knows? But have that kind of at the very end instead of the very start. So this way you're always very focused, with the opportunity of the patient to talk about more things if they need to. And then check for the physical findings. Most attendings don't want you to check every single thing, so just check for the physical findings you wrote down. Obviously check their heart and lungs. For most patients, almost always do it on all the patients. So check your physical findings, write them down, thank the patient for their time, and tell them you'll come back with the team or the resident. So now here's what we got. We are still at our patient, the questions that you asked, and now you can update them with the answers. You can write this on a piece of paper because it's probably not efficient to go back and forth to your computer. But if you can't go to your computer, just update these questions so it makes your note writing even easier. Update your physical exam findings. And then the step number 6 is you just want to create your updated plan. After you know what the patient kind of had, you may have more information. Maybe their fainting sounded something like they were just nauseated or just fell over, but they actually didn't faint. Or maybe it did sound like a cardiac problem. They said their chest hurt when they fainted. So now you want to know what labs and orders you want to do, what meds you want to give them, and then take a guess. Say, okay, talk to the resident. Say, resident, this patient fainted yesterday, and the resident will probably say, yeah, she told me that too. They said their chest hurt, so I was wondering if we could go ahead and just do an EKG today. I'm worried about like an arrhythmia. And the resident may say, sweet, that sounds awesome. That's what I was thinking. Or probably not. She also told me this, and I'm thinking more along the lines of this. But once it's confirmed, add it to your note and get your presentation ready. So here's what we are. We talk to the resident and we understand, these are the problems the patient's having. These are the solutions I want to do. And you and the resident have now talked and understand what direction to go into. You have at least a confirmed plan for a doctor, even if one in training, at least a doctor. So now you have your presentation, guys. Look at this. You have a note where you can just take your progress note is almost done for the day, and you can basically take this format and talk about the patient. Let's say, for example, you said patient A, Mrs. Johnson overall is doing well, but overnight she did have a notable event of like a near syncopal, near fainting episode. She said that she doesn't know what happened, but said that her chest hurt. She didn't hit her head on the floor, and she didn't ever lose consciousness. She just kind of fell over. Otherwise, no acute events overnight, and her labs have been stable. Her vitals have been okay. The surgeon that was supposed to come see her yesterday for her foot, whatever, said that they're going to delay her procedure for a couple of days because of booking. And physical findings, I did X, Y, and Z. This is what I found. My plan, or our plan today, is for a syncopal episode, go ahead and do an EKG. For her foot, delay surgery until 3 more days, and then move on from there. You have a note. You don't have to even look at creating another presentation. You've seen your patient, you've written your note basically, and now you have your plan that you can pretty much give effortlessly in the form of a presentation. And then once your attending basically tells you, oh, that was good, or I think we should still change this after they see the patient, then add the confirm plan and finish your note. So, now instead of the resident, say what the solutions the attending basically decided, and update your note there. Add in any little bits of details here and there, and your note is written, guys. That's the sweet part about this. Um, so your note's written, shortly after rounds, probably before lunch for most of your patients. If not, you're going to finish basically right after lunch. Most of the time, I would finish basically as soon as I got back from rounding, and that gave me the rest of the day to take care of my patients and do the following tips, which is you got to start creating a daily to-do list. You need to know how to take care of your patients best, and how, again, going back to the video, the last live session I did on just how to crush it and how to get honors from your attending. One of them is about being a co-resident and taking on responsibilities like you were the resident on the team. So ask yourself, what can you take care of for the resident? And maybe something as simple as, okay, part of the plan is to call the surgeon and confirm that they're going to be able to do it in 3 days. Part of the plan is putting in the consult order to have an EKG come up. Can I take care of those for you? And if you can put those on the list, then your resident says, yeah, you can do those, then take care of them. It makes their job so much easier. They're going to love you, and it also makes your job a little bit more interesting because you're actually doing doctoring stuff versus just writing notes. And then who do you have to speak to? Do you have to speak to the social work, the nurse, back to the patient? Do you have to go back and ask some questions? Just keep a list. But create, also, this is kind of a last little bit thing, create your daily to learn list. This may sound interesting, but over the day, even in the early mornings, you're going to hear things that you're just going to nod your head and you actually don't know what they mean, or just don't understand them well. So if you have a patient that comes in with chronic pancreatitis, you may see a lot of acute pancreatitis, but you don't know what long-term pancreatitis really means or how to treat it. So you're just going to write, how to treat chronic pancreatitis, and put that on a list. So that way, if you do have some downtime, you can start reading about that condition, or when you go home, you know what type of things you should be looking up. So the next day is a little bit more easier and understandable. So create your daily to learn list, so you can focus on doing what you have to do. So here's our note again. At the very end, I'm just imagining that this is a scratch piece of paper that you've been working on, but it may be your actual note. Just use your daily to-do list, item 1, 2, and 3, and make sure you get through them, obviously, before you go home for the day. So that way you're just knocking out work for your resident. They're going to be impressed with how efficient you are. And then finally, just plan for tomorrow. Before you end the day, you want to just go ahead and understand what you're going to do tomorrow. It actually, if you add this with the rest of it, you'll realize how this just becomes a cycle of efficiency. So, for example, you may already know what the patient is going to have done tomorrow. Maybe that surgeon is going to see them tomorrow. So you can start drafting the note for tomorrow for that patient and just say, foot problem. Maybe they have an ulcer and the surgeon is going to debride it. So they're going to come see them. So you can say, foot ulcer as one of their problems. And you can say, we'll be seen by surgery tomorrow. So you can add that to your note. Things that are definite, again, they may change and you can update them, but these are written, so they saves you little bits of time. But if you do this over all of the things that the patient has, you're going to set yourself up for a lot of free time. You can also I always like to write my notes and basically say no acute events. And if they do have acute events, I just take that out and add in what they did. But if they didn't, then I already have it written in. So those small things, guys, really goes a long way when you multiply it by 3, 5, 6 patients, however many you care for. And then the last thing, obviously, is see your patient on the way out. If they're struggling with something at the very end of the day, you can mention it to your resident, or you'll know about it. So like if your patient's saying, oh, I'm having a cough, I don't know where it came from. The next morning you can say, oh, Miss Johnson, how's that cough doing? She may say, oh, it went away, or it's still there. Then you have another problem that you may want to take care of. So you can start drafting this for the next day, overnight events, questions you're going to ask that day, physical exams, plan. And this is kind of drafted, so there's nothing that goes in, but you may be able to add your plan and some daily to-do list where for example, oh, I need to talk to social work tomorrow, or I need to get some records. Add those to your list, and so that way when the day starts the next day, you already have a list of what you can be doing versus asking your resident, what can I help you with? So hopefully you guys enjoy this little note structure. It's kind of fun for me to make it, but it's super efficient, guys. So hopefully you can see the value that comes with this system. It was 9 steps. And so let's review them really quickly. So You want to come in with a picture of how your patients are doing and understand who is more critical or more of a priority to see first. You want to check the numbers and updates. How are their labs doing? Did the consults say anything? Did anything happen overnight from the residents or the nurses? You want to plan your interaction. So what questions are you going to be asking your patient, so that way you can have a very strategic interview and not have them waste your time and you don't waste theirs. 4, you want to pre-write your notes. Use the information you already have in the first 3 steps to start getting the ball rolling and finish up. Next, you want to go ahead and have some efficient patient visits, right? So after you write your notes, you know what questions to ask them. You're going to ask those questions, get in the room and get out, let the patient sleep or be bothered by another medical practitioner. So just go ahead and make those visits very efficient. You want to confirm your plan with your resident once you kind of understand what direction you may be going in. And then once you know what the plan may be, present that to your attending, update it based off of their recommendations, create a to-do list of what you're going to be doing that day, finish your note, and then plan the day for tomorrow. Start drafting that note so that way it's kind of ready for you to just fill in based off the daily occurrences. And those are really the 9 steps every single day, guys, especially if you're on wards, but you can adapt this if you're on clinic too. Because clinic, you can probably see what patients you're going to see the next day, so you can start drafting those notes, or at least having notes of what questions you want to ask the patient. Based off of their last visit at the clinic. So, this is 9 steps. And if you follow this over and over again, you're going to become efficient on writing notes, presenting, seeing your patients, and you're going to be like an actual clinician and not just a med student that is trying to get through clinical duties and is stressed out. So hopefully you guys enjoyed this. If you did, really quickly, just take a section to, after you watch this, just comment down below in the actual comment section, not the chat box. The chat box is good for the live event, but you want people that are coming back from the replay to say, okay, this was pretty cool. I enjoyed this. And just comment below what's your biggest takeaway or what you enjoyed, or if you enjoyed it, saying, okay, this was really helpful. Just comment down below. It really helps me. Because if you did enjoy this, I just want to know. You can add something as simple as like, awesome advice, Lux. Thank you so much. And if you have any questions, if that was unclear, first of all, I apologize. And 2, just let me know where my lapse in communication was, and I can make another video, just kind of help you succeed on your medical journey. So hopefully this video is helpful, guys. Last thing is, if you do put a comment in below this video at the release of the book and the release of the project, I'm going to be giving 1 lucky subscriber. So you have to be a subscriber. So if you're not, you have to subscribe. Who comments down below anything, but you can write, awesome video, something along the lines. And if you subscribe, then I will go ahead and give you a free copy of the final product as a thank you, just for your support. So again, comment down below. There's more to it than just this book, but I'm trying to get to my impossible goal, which is that 25,000 subscribers. And to get there, I need as much interactions on my videos as possible. So here's just a little bit of an incentive. So again, free copy of the clinical guide and the final product for 1 lucky subscriber that comments on this video. If you have any questions, guys, go ahead and comment down below. I'll hang out after I end the live session on the video portal, so you guys can ask me some direct questions if needed. But if not, don't forget to subscribe to this channel to help me get to that impossible goal. If you are, like this video and share this with somebody, or share your favorite video from the channel that you really enjoy, to just kind of help me help as many med students and pre-meds as possible. Hopefully you guys enjoyed this training. I'm trying to incorporate this more and more, because I realize I have a lot of systems in my tips bag, you could say, and I want to be able to share as many of them as possible with you guys. So hopefully you guys enjoyed. Now go crush it and go get those honors. Just do well on your rotation. Thanks for watching, guys, and I will see you guys in the next live session. Take care.